Before the establishment of the AFPRC hospital in Farafenye, the North Bank division had been poorly covered by health provision services. In recent times, however, the region has seen the biggest infrastructure developments of any region in the country. There, 10 new community health posts were built to support primary health care delivery, and a new minor health center was provided at Ilyasa, complete with staff quarters. Ramukul Sise was the manager of the project that oversaw the revamping of the North Bank Division's health network.
This project, which was a 3-year bilateral cooperation, was aimed at strengthening the primary healthcare system in that part of Gambia. And the whole intention was definitely to help improve the health status of the population of the North Bank Division. And how did we intend going about that, or how did we do it? The main thrust was definitely to improve on the existing quality of the services, and also to improve on the geographic coverage, to improve access to such care in our facilities and at the community level.
In a project supported by the African Development Bank, Basse Health Center in the Upper River Division is being upgraded to the status of a major health center with a theater and a labor ward. Health centers in Fatoto and Yorobawol are also being rehabilitated and upgraded.
Basse is one of our major health facilities. In fact, it's supposed to be the referral point for all the health facilities in this part of the country. Presently, this place is undergoing an expansion. Now, it is supposed to be upgraded into what they call a major health facility category B. That is a health facility that will be about between 120 to 150 beds. Now, the project is under the participatory health, the component called the ADB. Now, they're expanding this thing, they are building wards and operating theater. That's what is going on here currently. The maternity wing is also going to be expanded to cater for a lot of people at the same time. Currently, that is what is happening with participatory health. In other developments also, the National AIDS Secretariat is also building a prototype, RH clinic. Now, this, of course, is happening in most major health facilities in this country, but that is what is situated right in the center of the facility here. An RH clinic should cater for more services than what we are used to when we talk about maternal and child health services. That one is narrow focus. The RH is more broad focus than the maternal and child health. So that is what is at the center of the facility. Currently, these are the existing activities that is going on in Basse Health Center. Yeah. One of the commitments of the government is to make healthcare accessible to everybody. And currently, if you see what is happening here, this facility is more or less serving as a transit point. Facilities, patients are referred from other facilities just to be referred again to Bansang Hospital. If we have all these facilities here, the referral level rate will be much reduced. So that's the impact it will first of all make. So it's going to be very important, and it's going to be very good for the people living in this part of the country, because actually financing healthcare is not easy. If for the government, much more for the common citizens of the country. So if healthcare is made accessible to everybody, that is a step in the right direction.
Another health facility in the process of being transformed into a district hospital is Kuntaur Health Center.
Kuntaur is a major health center. It's the only major health center in the division, and it is located on the north bank of the division. Looking at the distance traveled by people for referrals from Kaur, Chairman, it is a very long distance transporting patients to Bansang Hospital. So it has been realized that it will be of great importance to put up a structure that can sort of accommodate or serve all the facilities on the North Bank as a referral center. And in that facility, they are sort of expanding it so as to accommodate all the facilities, all the services that can be rendered at the hospital, be rendered at the major health center.
So far, presently, there are a lot of construction going on. Presently, where we're standing is the reproductive health unit. which started about 6 months ago, and they are just under completion now. We have other construction that is also undergoing within the health facility. Contractors are the ALCO company, but then PNP is responsible of the construction. We have a lot of structures that have been changed because this health center was a major health center before, but government looking into the situations of Kuntaur and Nyani, CRD North, they realized that it is necessary at least to upgrade this place to a district hospital. And that's the construction that is going on presently. We have a lot of buildings that have been, we go around and then you see a lot of structures that have been changed. Presently, they are building up a theater, they have a laboratory, we have and we're going to have an X-ray here, and we have going to have doctors who will be brought here to work within this area, so that the referral system to Bansang would be minimized. Because looking at CRD North, government felt definitely it is very necessary to have at least a solid structure within this area so that the movement of people to Bansang will be reduced. So that was some of the aims that government have already looked at actually.
But while Kuntaur is still savoring the prospect of its imminent conversion into a district hospital, Soma in the Lower River Division has had some 3 years of operation as a major health facility offering all of the services expected of a hospital.
We have a lot of facilities now, and including the theater. We have an operating theater, we have site savers, we have a laboratory. All those have been expanded, so this is what makes it actually a major health center. Before, patients need to be referred to either Bansang Hospital or the RVH. But now that this expansion has been made, with the help of the Cuban doctors, we are able to manage a lot of cases here that used to be referred. The services are well improved now, and most of the patients now would love to come here instead of being referred to places where they have no relatives.
Further down the main South Bank Road from Soma is to be found another of the new provincial hospitals, Suleiman Junkung Hospital in Buyam in the Gambia's Western Division. Recently completed, the hospital has since commenced serving its community. The chief executive there is Keba Baji.
If you look at the geography of this country, from Serekunda right down to Bansang, there is no other hospital other than Bansang. And this hospital, it was thought fitting that when it is fully operational, it will cover from Brikama to Pakaliba. So the catchment area is so large that it was worth fitting that we have a stopgap measure somewhere that a hospital can be put up to complement the efforts of RVH, because RVH is becoming oversaturated with patients. We have seen patients up to around 20,000 coming into this place. So in the North Cell, we are seeing more than 1,500 patients a month. Outpatient services, including inpatient services. But we also have, in addition to that, 8 outreach stations for MCH services, that's maternal and child health. That's the largest coverage in the entire country that we are doing. This is a teaching hospital. It has been identified and accepted, or agreeably accepted, by the Faculty of Medicine. They came here on a conducted visit and they think this is the most ideal place for teaching. This is why the medical records that I have integrated into this place is second to none in this country. It is the type of records, automated records, where you can get any other information that you need and even seek consultations from any other circles in the world. And it is so unique and important that the ministry thought it fitting that they have to replicate what is here to the other hospitals.
But while management at Suleiman Junkung considers the transition to the status of a teaching hospital, that distinction so far belongs to only one institution. Perhaps the most spectacular infrastructure and institutional transformation to have taken place in the Gambia's health sector has seen the Royal Victoria Hospital go since 1999 from the country's leading general referral hospital to the Royal Victoria Teaching Hospital, partially accredited by the West African College of Surgeons to train postgraduate doctors. The Chief Medical Director of the Royal Victoria Teaching Hospital is Dr. Pamela Esangbedo.
The hospital is central really to the health caring system of the government of the Gambia, by virtue of the fact that it is the tertiary center, the only referral hospital, and has recently become a teaching hospital. It offers specialist services to the populations, and not only Gambians, coming also from the sub-region. And really, it's the last port of call. I mean, if we cannot do anything here for you, then you'll have to go abroad. So it's quite central to the healthcare services that we offer in the nation. If you go around the hospital, you can see that its structures have been upgraded tremendously. And we have had to do that because of the conversion from a general hospital to a teaching hospital. We have had to put up a lot of new structures. We've had to refurbish our old structures. It's all to make place for medical students that are coming on board. Currently, we have 2 sets of them here. And we had to do things, provide things like lecture theaters, seminar rooms, teaching labs. And in doing that, we had to build new accounts units, new pharmacy units, new dental units, library, pediatrics. I mean, just name it. We'd had to do that so that we can upgrade the structures to be that of a teaching hospital. In February of this year, we had the West African College of Surgeons holding its 44th annual conference here in Banjul. We hosted it. And during that period, they did accredit the hospital and gave us a partial accreditation to train postgraduate doctors. For the undergraduate doctors, we have partial accreditation as well, but that is from the Gambia Medical and Dental Council. I think we've worked hard for it. We've invested a lot in it. And we're certainly looking forward to people who will now join the health sector and help us with our healthcare delivery services. We're certainly looking forward to them graduating, and I'm sure the whole country is actually looking forward to that.
After successfully completing the preclinical studies at the University of the Gambia School of Medicine, 15 Gambian students are now doing their clinical studies at the Royal Victoria Teaching Hospital and looking forward to graduating in 2005. The Dean of the Clinical Sciences Division of the Faculty of Medicine of the University of the Gambia is Professor Etim Essien.
It is necessary for each country, if it is at all possible, to train its own cadre of doctors. For up till this moment, I'm sure we all know that the Gambia has depended quite a lot on the services of its indigenous staff, but who are very few, have not been able to meet the needs of the country. We have depended in this country on the support of the friends of the country, including the Cuban government, the Nigerian government, and other friendly African and non-African countries. They've supported the training of the doctors and actually also sent doctors to come and work here. This is an expensive and really not a very satisfactory way of solving the problem. The permanent way of solving this problem is for what the University of the Gambia is doing, training the Gambians to work for their country and who will qualify and should work in their country. And these people that we are training, we mean and we expect them, and we've emphasized this, they should be equal. We train them, we are applying the same standards as are used in training doctors all over the world, in the same format that we are adopting. And therefore, they should be able to hopefully meet with, in time, in course of time, meet with the need to meet the health needs of the Gambia as far as doctors is concerned. That's our exclusive focus, the training of doctors.
After finishing my grade 12 exams, applied for the university, got my my application was approved, and then went to the pre-med for 1 year, where I did basic sciences, physics, chemistry, biology, and calculus, and then for 2 semesters, and then passed my exams, and then was accepted finally into the medical school. And then I did my preclinical 1.5 semesters, almost 2 years, and then took another exam, and then right now I'm in my 4th year clinicals.
So how many more years do you have to go?
We still have about 2.5 years more to go.
Okay. Is it a difficult course?
Yeah, it's not difficult, it's demanding anyway, because like you spend almost the whole day, you always have to be there, especially your clinical year. At least your pre-clinicals is only classes and lectures and maybe tutorials. But the clinicals, you still have your classes, your lectures, your tutorials, and then you have the wards. So it's really demanding, not difficult per se.
Okay, so what drove you towards medicine?
I've always had this ambition of being a doctor. I think maybe I was fascinated with the whole thing of the white coat and then the stethoscope, but then I've realized that it's not just all about wearing the lab coat and hanging your stethoscope. It's more to that. It's about caring, and then it's just the whole idea of medicine is like giving humanitarian assistance. Because every day you see sick people. If you see people coming to the hospital because they have faith in you, that you are demigods per se. Because you have people, they go to traditional, they always come back to the hospital. It shows that they have confidence in you. So it's not just about the white coat and the stethoscope, hanging stethoscope, but then I've seen that really doctors are real humanitarians.
So you are looking forward to graduating in a couple of years' time?
Yes, in the next 2.5 years. And then it's just, as I was saying, it's really challenging, but then thank God that we have our professors by our sides, the lecturers, the hospital staff of RVTH, my colleagues, and then I forgot the first gratitude and appreciation go to the government, or the people of the Gambia, especially to the president, for initiating the establishment of the university, especially the medical school. It's really a step in the right direction, because there is nothing like having people from the same environment treating people from the, because like cultures are different, languages are different, you have language barriers, but when you have people from your own community, people are more secure, and then communication is easier.
Okay, I was going to ask you, but you have answered. I was going to ask you, are you going to work in the Gambia when you finish your studies?
For sure, because medicine is about relevance too. As I said, like what I said, barrier, cultural barrier, and people know you here, and people appreciate you here, because it's just like if you come to the hospital and then you don't speak English and you speak Wolof to me and then I answer, you feel much comfortable, you feel much at ease. And then why practice outside when in your country everyone appreciates you? I think, except maybe for postgraduate, and I'm sure the RVTH, it's going in that direction to train not only medical students but then postgraduate students, which I would be really happy to be part of.
Okay, Bintu, we wish you the best of luck for the rest of the course.
Thank you.
Okay, Abdu, how many more years do you have to go to graduate?
I have actually 3 years to go and graduate.
So was it very difficult to find a place on the course?
Actually, it was not easy. It was what would I call it? It was competitive, because medical course anywhere in the world is never easy, and then to get a place to a medical school anywhere in the world is competitive. But thank God, I am so opportune to be in the medical school of the Gambia. Yeah, I just believe it's a privilege.
Okay, how is the course like? Is it a very difficult course?
I will not call it difficult, but I'll call it intensive, because it demands a lot of sacrifice and lots of time to spend on it, because it's a very, very jealous course. Whilst you are doing it, you cannot interfere with other things. You have to concentrate too much on it because you are dealing with human life, and human life is the unique thing we have. Therefore, it's a very, very intensive course.
So that means when you finish your course, you intend to stay in this country and work?
Yeah, indeed. The greatest advantage we are in fact having here is that studying here gives you more privilege to understand your own people. And then the diseases which are prevalent in this sub-region, you'll understand them more. And then you'll be able to counter them and then treat them the way they are supposed to be treated. And then this gives us the opportunity to understand our own situation. And I'm ready to work in this country, yes, to help my own people. Because I think Gambians need my service than any other person.
Okay. Before, Gambian doctors used to go abroad to train. So you would consider it a major privilege that now we have our own training institution and we can train locally to become doctors?
Yeah, what I normally say, this is one of the bold steps the government of the day has taken in establishing a medical school. I know training Gambians outside this country is very expensive, especially in terms of medicine. As I said earlier, medicine is not easy anywhere in the world, and it's competitive and expensive. The number of students we have currently studying medicine here, if we are going to send those people to abroad to study medicine, is virtually impossible for this country to do, because the amount of money they are spending on us here to study here is far less than the amount of money they will be spending on sending this number of students outside. This is a bold step of establishing a medical school, and it will go a long way in trying to develop the healthcare delivery of this country, because training your own doctors to stay in your own country, understand your own people, and they'll be able to give the sacrifice your own people need, because as we always say, blood is thicker than water. We are all related. You'll be able to give that sacrifice to your own relatives and your own people in your own country. Though medicine has no boundary. If you are a doctor, you are a doctor. There is no discrimination. There is no prejudgment. But studying in your own country is an added advantage.
Okay, so do you intend to do a postgraduate course after this?
Yes, I'm actually looking forward to study and then become a physician. I want to do a postgraduate course and then come here and settle as a physician and work for my own country.
Yes. So you are looking forward to graduating?
Yes, I'm looking forward to graduating because I believe that's going to be a wonderful day, not only for me and for my family, friends and colleagues, but it's going to be a wonderful day for the whole of this country, because they will have their own doctors, their sons, their daughters, their brothers and their sisters to be here with them and then to work for them.
Okay, we wish you the best of luck for the rest of the course.
Okay, I thank you very much. I'm so happy.